People with a pre-existing mental health condition are definitely at a greater risk of experiencing worsening symptoms during the pandemic. So if you already have anxiety or depression or some other mental health condition, please make sure that you're taking care of yourself, taking care of that you're taking your medication as it's prescribed, continuing to participate in therapy if that's something that you've been doing, and taking care of all of the other things that you do to cope for yourself and care for yourself. So some of the things that are evident in adults are not really so evident in children. Children can react a little bit differently with stress. So if you have a child who is maybe crying excessively or very irritated, or a teenager who's kind of acting out, that could be a response to the pandemic that they just aren't able to articulate. Also, sometimes we see children returning to behaviors they've outgrown. In younger children, that could be, wetting the bed. In young people of any age, it could be unhealthy eating or sleeping patterns, or obviously people of any age, not just young people. Young people also will be struggling with difficulty with attention and concentration. Frequently, we see unexplained headaches or body pain with people who really have a difficult time expressing their feelings, and oftentimes that's children. They'll complain of stomach aches or headaches when in fact it's fear or worry or anxiety that's really plaguing them. And then also some people can avoid activities that they really have found enjoyable in the past. So those are some things just to look out for. So one of the things that I was thinking about when I was asked to present this webinar is, do you create art or not? Is that something that people want to use, or that artists want to use for an outlet for their stress or anxiety? And it really made me think back to something that a colleague told me about 15 years ago. He told me that he was working with a young woman who was an artist, and she had experienced some severe abuse. And her therapist, this gentleman, her therapist at the time, really wanted her to use her art to express her feelings about her abuse. And it took her a little while to get to the bottom of her feelings, but she realized that that wasn't something that was healthy for her. Because for her, if she infused her art with her feelings about her abuse, that would ruin her art and her creative outlet for her. And so for her, it was very important to keep her art separate from her healing from her abuse. And so, for those of us who are not artists or we don't do a lot of art, I think it's important to be cognizant that everybody isn't going to use their typical creative outlet in expressing their feelings or to try to cope. Some of the things that I was thinking about in preparing for this webinar was, if creativity is really important to you and is a really important part of your creative outlet or your healing, you might want to try something else. Like this picture here. There's a lot of people online that are recreating famous artworks, through different modalities. This woman has a lot of some toilet paper wrapped around her neck, and looks like a winter scarf that sort of replicates the front, the brocade of the gown in the painting. This has been a famous or a pretty popular meme on Instagram. The woman on the left there in the modern times, I believe her name is Diana Director, and she, I think, was the first one to post this with the Purell earring on herself and also on the girl with the pearl earring. So some people are finding using humor and using their art in different ways. Some people might want to try a different form of art. If you're a 2D artist, you might want to experiment with 3D art, or if you're a painter, you might want to experiment with, like if you're an oil painter, you might want to experiment with pouring acrylics, or, or the written word or something like that. So I just want to let you know, or just to talk a little bit about that don't feel like because you're very good at something that's your path to healing as well. I thought this was another cute thing that somebody did, again with another famous painting, kind of made it into a public service announcement about washing your hands right now. So also some other things to keep in mind are to maintaining regular life rhythms, like waking times and bedtimes, also meal times. And those are things that can be very helpful to children if you're taking care of children in your home. Also, try to focus on things that you have control over, because many things right now we don't have control over, and that can be very scary. Some people find it helpful to do things that you can start and finish, like vacuuming a room, or organizing a drawer or a closet, rearranging furniture, going for a walk. So some of those things that have a beginning and an end can give you a sense of control and can make some people feel a little bit better. I know a lot of friends of mine have started doing jigsaw puzzles and crossword puzzles. And I know for myself, as I was cleaning out a drawer, I found a half-done cryptogram magazine, and had a lot of fun doing several pages of that, because I hadn't done one of those for years. And again, that was something that brought some instant relief. I could start it, and I got to the end of it, and it was just kind of fun, and it really took my mind off of things for about a half an hour or so. Other people are finding a lot of fun in listening to podcasts, particularly comedy podcasts, or watching things on Netflix that they've been wanting to binge watch. And like I said before, also, I noticed that a lot of people are cooking a lot more and trying different things that they thought would be fun. So I want to talk a little bit more seriously now. Anxiety and depression are probably two of the more common mental illnesses that people suffer from, and they're real. Anxiety and depression are not things to be ashamed of. They aren't something that typically can be cured by pulling yourself up by your bootstraps or buckling down and trying a little bit harder. They have their roots in your neuroscience, or the neurology of your brain. And there are also things that can be treated relatively easily. And during a time like this with the pandemic, symptoms of anxiety and depression can certainly get worse if they're not treated. And I think as I was thinking about this time, I think most people are probably experiencing more anxiety than ever before. People probably who had never experienced it before. And anxiety a lot of times can be coupled with physical feelings in your body, like a racing heart or knots in your stomach. And if anxiety is experienced in an extreme form, it can be experienced as a panic attack. And panic attacks are things where you feel your heart racing and you can't catch your breath. And sometimes people feel like they might be having a heart attack. They're very, very scary. So it's very important to pay attention to the feelings that you're having in your body. Panic attacks typically reach their peak level of intensity in about 10 minutes or so, and then they begin to subside. Sometimes they can mimic, like I said, symptoms of heart disease, thyroid problems, breathing disorders, or other illnesses. And it's very important to seek out medical help either through an emergency room or through a visit with your doctor. Because again, anxiety and panic attacks are things that can't be treated and can be treated relatively easily. It doesn't mean that you won't experience them again, but they can be treated relatively easily. Some other symptoms of a panic attack are trembling or shaking, sensations of shortness of breath or smothering, feelings of choking and chest pain, nausea, dizziness, possibly some numbness or tingling sensations, and a feel of losing control or going crazy. So it can be very, very scary. But again, it's something that can be treated. So one of the things that I wanted to share with you today is the Indiana Family and Social Services Administration put together a new website, and it's called Be Well Indiana. And I have the web address at the top of this screen, and it will also be at on the very last slide in the presentation today. And I'm going to click onto another screen and bring up this website, because I want to walk through a couple of screens that I think are very important and that you could find very useful. Now just bear with me for a second while I get rid of my some of these extra things on the top here. Okay, so if you see at the very top, you can see that the web address is bewellindiana.com. Everything on here has been checked and resourced by folks at either the Division of Mental Health and Addiction or at the Family Services Association. And so we're confident in all of the material that's here. So it starts out with, we're here to help. And if you scroll down a little bit, it talks about the pandemic, the COVID-19 pandemic, and some resources. And I'll be clicking on some of these here too. Here's some information, scientific information, information about COVID-19 in Indiana, and some tips for daily coping. Best ways to prevent getting sick, what to do if you are sick, coronavirus and crisis counseling. And then here are some other types of assistance for Hoosiers. So SNAP is cash assistance for people who need help with their everyday living expenses. There's insurance information and also information about children and families and supports for them. There's the Indiana Unemployment Resource Center and child care resources. I should also say that this website will be maintained ongoing. This is not something that is popping up for the COVID pandemic and then will be going away. It's something that we will be maintaining, from here on out, because I think the information in it is very helpful. And it's a little bit easier to navigate than our state website. There's a mental health self-assessment, which I will get to in just a minute here. Some wellness resources. KeyConsumer.org is an organization that's made up of people who experience mental illnesses, and they support each other. Some information for youth and families, your young people and families. So if you have young people at home, this might be an area that you want to look at. Resources for helping children cope, resources for teens. Domestic violence, the instance of domestic violence has increased, as well as the instances of child abuse during this pandemic. and then information about substance use disorder and recovery resources. There are 12-step meetings that are online, and I will show that to you too as I scroll back up and click around a little bit more. So there are 12-step meetings that are happening online. I believe you can access them at almost any time of the day. So while folks in recovery a lot of times find that in-person interaction really helpful, I think one of the benefits of having 12-step programs online is that they can be right there at your fingertips. You don't have to wait 3 hours or drive half an hour to get to one. It can be right there when you need it. So I'm going to scroll back up to the top of the page here kind of quickly. Sorry about that. That's hard on the eyes. And I am going to click on Get Support up here in the top right-hand side. So here's some other options. Suicide Prevention Lifeline, Veterans Crisis Line. Now I'm going to click over here to mental health. And there we are at the key consumer again. And assistance. You know what, I'm not seeing the thing that I want to find. I'm going to just scroll down because that's a little bit easier for me to find it that way. Here it is, the mental health self-assessment. This is the one that I was looking for. So I'm going to click on the link in the lower right-hand part of the page. It says make a mental health test. And this will take us to a page on that's available on Mental Health America's website. And this is something that they put together that I think is just really incredible. So I'm going to scroll down a little bit and then I'll click on one of these tests and we'll kind of take it together. So as you can see, you can take a self-screening test for depression, anxiety, psychosis, bipolar, eating disorder, PTSD is post-traumatic stress disorder. You can get some information about parenting and youth and addictions. And then they have several in Spanish, or they have a couple in Spanish, one for depression, one for anxiety. They have a survey for work health. I've not clicked on that one, but they also have a survey for caregiver and better care for adults. And again, these are not diagnostic tools, they're screening tools. So if we click on anxiety, for example, and you can take a little test. So it says, over the past 2 weeks, how often have you been bothered by the following problems? And I'm going to click on nearly every day or more than half for all of these questions so that you can see what happens then or the information that comes up. So these are some very common questions that would be asked if you were to go to see a counselor. And again, it says that this is a test. This isn't a diagnostic tool. And so I'm going to click on next. And this will ask for some optional demographic information. You do not have to fill any of this in if you just want some basic information for yourself. So I'm going to click on submit without filling anything out. And we'll see what comes up. Okay, results and next steps. So according to this, the results of the screening tool is that I have severe anxiety. And the symptoms seem to be greatly interfering with relationships and tasks of everyday life. It says if I'm interested in learning more, check out the links below. And it says my total score was 19. So I can click on interpretation of scores. So I scored 19, so that's how they came up with the severe anxiety. And then this was the source of the information, of source of the scoring. And then if you scroll down a little bit more, you can get some more information. So what is anxiety? Am I crazy? What do I do now? So I'm going to click on what do I do now. So they say to take some time and sit with your feelings. Talk to someone and learn more. And again, it brings you back to treatments and resources. How can I manage my emotions? I don't like my therapist. And then you can take another screen. So I think this is a really wonderful, wonderful tool. Let's click on depression. And I'm going to say that this is maybe more moderate, or, I'm really not having that bad of a time. So we'll see what it says. Whoops. Whoops. Nope. Nope. What it recommends for this. And again, I'm not going to fill out any of the demographic information. Okay, so by answering those questions, it says that I have mild depression and my score was 6. And again, I have some things to click on. So I can't sleep. That's a pretty common symptom of depression. So why can't I sleep? And there's a video that I can listen to, or that I can watch. It gives you some tips for sleep hygiene. And then again, it brings me back to taking another screen. So again, I think that this is very helpful. And I just want to pause here, and Tanya and Heidi, is there anything in the chat box about any questions about this, the screening tools or anything?
Yeah, one person asked about the difference between a screening and a screening tool versus a diagnostic tool. So if you want to expand, Heidi answered the question. If you want to expand a little bit more on that, that might be helpful. Folks.
Yeah, a screening tool is just a way to determine whether or not you may or may not have a problem. So it's kind of like scratching the surface. And a diagnosis is given by a licensed mental health professional in Indiana. So that could be a licensed clinical social worker like I am, or a licensed clinical psychologist, or a licensed psychiatrist. And diagnoses are arrived at by a number of different symptoms. And we use a book called the Diagnostic Statistic Manual. And that has it's like the Bible for all of the different diagnoses that we use in the United States. And so people would have to score, or would have to have symptoms, like maybe 5 out of 7 symptoms at a certain severity to be diagnosed with a mental health issue. So that's the difference between a screening tool and a diagnosis. Anything else?
Hey, Gina, there was also a question when we first started about how or where to refer families for support. And I did share our DMHA website with the provider locator in the chat.
Great.
But maybe you wanted to expand on our 92 counties and our community mental health centers that are the catch-all for communities.
Sure. So the Division of Mental Health and Addiction receives money from the federal government to pass along to community mental health centers, which are located in every county in Indiana. And that money is used to help offset some of the costs for people who have no or little insurance. So community mental health centers are considered the safety net for mental health services and supports in Indiana, like they are in many states across the country. They also take all types of insurance, private insurance, Medicaid, Medicare, but people can go there if they need a sliding fee scale. And there are, Heidi, are there 24 community mental health centers across the state now?
Yes.
Yeah, 24 community mental health centers. A number of them have offices in multiple counties. And you can find that information, as Heidi said, on our website. There are also many other mental health providers across the state of Indiana. You can, I mean, it just kind of depends on where you live, and you could probably Google mental health providers and put in your city or your zip code and find folks. And again, mental health clinicians really vary widely from maybe a one-person therapist who, like me, if I could have a private practice if I wanted to. So it could be a one-person shop, or it could be 4 or 5 clinicians that work together, or it could be a very large organization with maybe 10 or 12 clinicians, or maybe 10 or 12 clinicians at several different sites across the state. So there's a lot of variation. One of the things to keep in mind is if you go to a mental health provider that does not have somebody that prescribes medication, then that person will have to refer you to somebody else, either to your primary care physician or to a psychiatrist in your area. So sometimes those folks work in they always work in conjunction with each other, but you can't, they're not necessarily a one-stop shop. Anything else?
There was also a comment, and it's from Sergio. Problems that I see with the screening tool, it could promote people jumping to specific screening without a proper diagnosis, and stating that people should not self-diagnose, but to see a professional.
Yes, that is important. This is just a tool to help you decide, geez, are the things that I'm feeling or I'm experiencing something that is kind of a normal level of anxiety that that maybe I can maybe take up a meditation practice, or something along those lines to cope with it, or is it something that might rise to a level where I might need to seek some professional help? That's the purpose of the self-assessment screening tool. It's to help you figure out, is this a level of something that needs professional help?
There was also some questions about child abuse and neglect, and Tanya answered them, but I'm just going to go ahead and type in the toll-free number for.
Oh, thank you. So I do want to show, there's a section over here for videos on the upper left-hand corner, and there's a video that our medical director at the Division of Mental Health and Addiction did on depression. And so I want to just take a minute, just take about 2.5 minutes and play that for you. And you'll have to let me know if you do not hear sound.
Hi, my name is Dr. Leslie Holvershorn. I'm a psychiatrist and medical director for Indiana's Division of Mental Health and Addiction, and I want to talk today about ways to get help for people with severe mental health or substance use disorders in the midst of the COVID-19 pandemic. Many people are experiencing significant increases in anxiety and depression recently. This is a very normal response to being in such an uncertain time. People already diagnosed with a mental health disorder like depression, bipolar disorder, or schizophrenia can also struggle during this time. This is in part because of the stress, but also because the programs, services, and people that usually stabilize us are not all in place right now. So more intensive and urgent care may be necessary. To determine if a person needs emergency inpatient services, a behavioral health clinician will need to ask questions like these. Have you been able to continue to take the medications that help you with your psychiatric disorder? If you've missed any doses, is it because it was hard to get the medicine from the pharmacy, or because no one has watched you take your medicine every day? Are you worried that you might harm yourself or others? Do you feel more withdrawn or like you are a burden to others? Do you feel constantly sad? Are you able to feed, bathe, and clothe yourself? Are you worried about your safety? If you or someone you are assisting says yes to several of these questions, seeking mental health treatment is a good idea right now. You can contact your local mental health center. Every part of Indiana has one. If you have insurance, your insurance company should be able to help you find a covered provider as well. To get the quickest help in a mental health crisis, call the psychiatric hospital closest to your home. Finally, if you are worried that you or someone you know might hurt yourself or someone else, you can always call the local police to help. There are special crisis intervention trained officers all around the state that can safely take you to a hospital for an evaluation. You can call ahead to request one of those officers to come help you. Thank you for watching. We are here to help you, support you, and to provide resources that will get you through this difficult time.
All right, so I want to go back to our to the PowerPoint again. I'm not sure if that gets us there or not. Let me, just a second here. Okay, so, whoops. There we go. So again, mental health conditions are by nature isolating, and it's important to help people get connected and keep connected. And it's also important to create a wellness plan for yourself during this time. And I think that the screening tools and the information and the resources at Be Well Indiana are one place to get some help. And so whether you want to cope by cleaning things or by using your art or using your art in humor, just it's important to keep moving forward. And if you have any questions, please feel free to contact me. My contact information, my email is there. And again, the 12 steps online are available at www.12steps.org. And there's the website for bewellindiana.com. And then you can also access the screening tools without going through bewellindiana.com and by going through to the Mental Health America National website and clicking on their screening tools. So Louis, is there anything else that you would like to add or anything else that you would like to have covered today?
I know that we're going to be sharing those website addresses and other information that you've provided at the end of the webinar. Those will be posted on our website, and you all who have participated in this webinar will receive an email tomorrow with links to all of those things, as well as the slide deck that Gina has used today. So you should really have all the information documented to you that you need from this presentation. Isn't that is right? I'm going to my folks and they're smiling at me, indicating that that was actually true what I said, which is a good
That is true, Louis. Thank you so much. I would just like to say, because I'm not seeing any other questions in the chat right now, I would just like to take the time to acknowledge and thank Gina, Heidi, and Tanya for joining us today. Your support of the arts community means a lot, and we really appreciate you. And like Gina said, if you guys have any lingering questions afterwards, please reach out to Gina and her colleagues, and or reach out to the Arts Commission. We'll put you in touch with them as well. We're happy to do that. Like Lewis said, we will be following up with all of the resources mentioned. Be Well Indiana is a great resource. So that's an easy URL to remember. Go ahead and check that out. But tomorrow we'll be sending out all the resources mentioned, links to those, also a link to the recording of this webinar on YouTube, so you can watch at your leisure, or if you're watching this in the future, so that you can watch it whenever it's best for you. We do have some more webinars scheduled for the following weeks, because we all know that the arts have value. But sometimes explaining that value as an artist or an organization is a little bit complicated. So in next week's hands-on webinar, we will be reviewing the key components of a unique value proposition, which is an entrepreneurial ask for what makes your work impactful. What's more important right now, right? We'll also talk about strategies for redefining your value during the crisis and adjusting your business model accordingly. A special invitation for that webinar will be going out tomorrow as well with those resources from today. Thank you all for joining us. We really appreciate it. And I hope you have a great rest of your day. Goodbye.